Hello, I'm Dr. Ilges, Chief of Surgery. St. Mary Mercy Livonia has created this video to help educate you about your surgical experience. Our skilled team of surgeons, anesthesiologists, nurses, and healthcare professionals all want you to have a positive experience with us. And we'll do our best to make your experience as comfortable and stress-free as possible. We hope to answer many of your questions about your procedure over the next few minutes and give you information to help you prepare for your operation and recovery. If you have any questions along the way, please speak with your doctor, nurse, or any of our team members. We're here for you. Thank you for choosing St. Mary Mercy Livonia.
As your surgery date approaches, there are several things you can do to prepare for your operation. By taking these few steps, you'll help promote a successful surgical outcome and speedy recovery. Physical activity will improve your blood flow and circulation, both essential during surgery and recovery. Eating a well-balanced diet and following a good nutrition plan will help promote natural wound healing. If you smoke, quitting or reducing your habit will reduce your chances of getting post-operative pneumonia. You should not smoke the day of surgery, and you should quit as soon as possible. If you need assistance, St. Mary Mercy has resources to help with smoking cessation. Before your surgery, you will receive a phone call from us to either schedule a pre-anesthesia interview at the hospital or schedule a phone interview. During this phone call, you'll be asked about your current medications and allergies. You'll be asked about your medical and surgical history. Having your medication bottles in front of you may be helpful. We'll confirm your surgery date and tell you which home medications may or may not be taken on the day of surgery. Most patients who will be going home the day of surgery will have a phone interview with a registered nurse. If your pre-anesthesia testing interview is in person, you may have some labs and/or diagnostic tests done at that time. Every patient is unique. Following pre-anesthesia screening and testing, you may be given additional information or instructions. Those instructions may include seeing your primary care physician and/or your cardiologist. You will receive eating and drinking instructions from your healthcare provider. It is important to follow these instructions. You will need a responsible adult companion to accompany you the day of your surgery and to drive you home. Because of the anesthesia, you will not be able to drive 24 hours after leaving the hospital. It's also a good idea to confirm your arrangements with your companion the day before. On the day of your scheduled surgery, here are important things to remember. Please shower or bathe using an antibacterial soap or following the bathing instructions from your healthcare provider. Do not put on any lotion, perfume, cologne, deodorant, and do not wear any makeup. Wear loose-fitting clothing. You may brush your teeth and gargle with mouthwash, but remember, do not eat anything, including breath mints, and do not chew any gum. Take only the medication you've been instructed to take, and take them only with a sip of water. Leave your valuables like jewelry, purses, and wallets. Bring your ID and insurance card. A form of payment may also be requested. Bring your glasses and hearing aids. Leave your contacts at home. If you must wear your contacts, bring your storage container. You will be asked to remove them prior to surgery. You'll also be asked to remove any dentures or removable dental work, body piercings, wigs, hairpins, hair clips, or wedding rings prior to surgery, so you may want to leave those home too. Do bring crutches, your walker, or your cane if you use an assistive device for walking. If you are being admitted after surgery, you are welcome to bring the following items: pajamas, robe, and slippers, although hospital pajamas and gowns are available. Comfortable walking shoes, if needed for walking after surgery, personal toiletries, and your CPAP machine if you use one for sleep apnea. As a courtesy, we will check your machine to ensure proper functioning. Your surgery will either take place in the main hospital operating room or in the outpatient surgery center called the OSC. These are two separate locations. We will inform you of your location prior to your surgery. You and your responsible companion should arrive at the hospital at your appointed time, which will be an hour to an hour and a half prior to surgery. If you are having surgery in the main hospital, enter the hospital grounds at the entrance off Levan Road and enter the hospital through the south entrance. After entering the south entrance, take elevator B to the second floor and check in at the surgical registration desk located in the surgical waiting room. If you are having surgery in the OSC, it's located directly across from the hospital at 36622 5 Mile Road, Suite 201 in the Mendelssohn Professional Building. Enter through the main entrance and take the elevator to the second floor. Check in at the OSC registration desk. If you require a wheelchair, there will be one waiting for you at each entrance. Valet service is offered at the main hospital for a nominal fee. Once you're in the surgical waiting area, you can confirm your arrival with the receptionist, who will give you a brief orientation and introduce you to the surgical services tracking board. The tracking board allows your companion to follow your progress through pre-op, surgery, and recovery. Each patient is assigned a tracking number, and only the numbers appear on the screens to ensure confidentiality. Your companion can leave a cell number with the receptionist or use our restaurant-style pager that'll work anywhere inside the hospital. When your name is called, you'll be escorted to the pre-operative unit by a member of your surgical team. Companions will need to wait for the first part of the preoperative care, which typically takes 40 to 45 minutes. Once you're in the preoperative room, your height and weight will be verified. Your vitals will be taken. You'll be asked to use the restroom and change into a surgical hat and gown. You'll be given a bag for your personal belongings. For your safety, it is our routine procedure to verify your information several times before your surgery. Questions may include, what is your name and birth date? What kind of surgery are you having, and on what part of the body is the operation? If you have not already signed a general consent and/or surgical consent form, you'll be asked to do so. Please take the time to review the forms and confirm that the surgeon and procedure are accurately stated. While in pre-op, a nurse may prep the surgical site and start an IV. You may also have sequential compression devices applied to your legs. These are stockings like sleeves that'll squeeze and massage your legs during surgery to promote blood flow and help prevent blood clots. Also in pre-op, you'll meet the anesthesiologist and nurse anesthetist, both of whom will ensure that you are safe and comfortable in surgery. They will review your history and explain the best options for anesthesia during your surgery. You may be given some IV medication to relax you before you go to surgery. Your surgeon will stop in to talk to you and answer any last-minute questions. Your surgical site may be marked at this time. Once you've had your initial meetings with the surgical team and received any necessary medications, your companion will be allowed to stay by your side until you are wheeled into your surgical suite. By then, you'll have learned the approximate length of the surgery, so your companion will be able to plan for his or her wait time appropriately. Most patients' last memory is of leaving the pre-op unit and then waking up in the recovery room with their surgery completed. During your surgery, companions will be able to receive updates about you on the patient tracking board. While waiting, companions are welcome to use the beverage and snack station in the waiting area or visit the hospital cafe, gift shop, Joe's Java, chapel, or in-spirit salon. Campus maps are available from hospital receptionists, and there is clear signage to help guide anyone through the facility. Your companion should carry a cell phone or the provided pager when traveling outside the waiting area in order to be reached with any updates. It's also helpful if your companion informs the receptionist upon leaving the waiting room. Following surgery, your surgeon will speak with your companion. In the main hospital, you will either go to the Phase 1 main recovery room or the Phase 2 outpatient recovery room, depending on the type of surgery and anesthetic you received. If you're in the Phase 1 recovery room, Your nurse will monitor you continuously and give you IV medication to help ease the pain and ensure your comfort. Following anesthesia, it's not unusual to experience chills or for sounds to seem louder. It's also common for time to go by quickly. You'll be medicated for pain, and your nurse will make sure that you're comfortable. Your nurse will also encourage you to take deep breaths and cough. Companions are not allowed in the Phase 1 main recovery room. The minimum stay in the Phase 1 recovery room is 1 hour, though longer recovery may be needed and is not unusual. Also in the main hospital, if you're leaving on the same day of surgery, your anesthesiologist will determine when it's time for you to move to the Phase 2 outpatient recovery room. Once you are stable and alert in Phase 2, you will be offered a beverage and maybe food, then given discharge instructions. While in Phase 2, your companion will be invited to join you. If your surgery is at the OSC, your companion will be invited to join you in your recovery room as you are being prepared to go home. Your anesthesiologist will determine when it's time for you to be discharged. If you're being admitted to the hospital, you will move from Phase 1 recovery to your inpatient room. The receptionist will provide your companion with your room number. Your room at St. Mary Mercy Hospital is private and has been designed with your comfort and convenience in mind. Once you get to your room, you'll meet the nurse who will be caring for you. The nurse will assess you and ensure that you're comfortable. You may be asked several questions about how you feel to assess your pain level. You may still have your sequential compression devices on your legs to promote circulation. You'll also learn a few tasks that you should perform in order to aid your healing. You'll be taught to cough and breathe deeply. This will help clear your lungs and decrease your chances of getting pneumonia. If your surgery is abdominal, you'll be taught to use a pillow to splint your incision while you cough or breathe deeply. This will decrease pain at your incision site. You'll also be taught to use an instrument called an incentive spirometer. This is a device which helps you inhale deeply to expand your lungs. It will also decrease your chances of getting pneumonia. You'll be encouraged to get out of bed, preferably on the same day as surgery. Simply taking a walk down the hall will help your blood circulate. Our patient care associates will be available to assist you. Depending on your doctor's orders, during your hospital stay, you may receive a blood thinner medication to prevent you from getting a blood clot in your legs or lungs. If your companion would like to rest or sleep while visiting, the sofa in the room converts to a bed. When your medical team feels that you're well enough to return home, you'll be discharged. Your companion will participate in reviewing your discharge instructions and any prescriptions. A written copy will be provided and any questions will be answered. Before you leave the hospital, your doctor and nurse will teach you some very important tasks to complete as you continue to heal at home. Most patients, due to the anesthesia, will not remember speaking with the surgical staff during recovery. It's important that your companion relays your discharge information to you once you're alert at home. Your nurse will review your medications that you'll be taking at home. You'll be instructed on diet, activity level, bathing, and wound care. Finally, you'll be given information on a follow-up visit with your surgeon, usually within a week of surgery. Remember, you will not be able to drive home and must receive a ride. When you're ready to go home, your companion can drive to the hospital or OSC entrance, and a patient care associate will escort you to your waiting car.
Thank you for watching the surgical experience video. We sincerely hope you found it to be helpful. If you have any further questions or concerns, please call the main number at the hospital, and your call will be directed appropriately. Thank you for choosing St. Mary Mercy Livonia and entrusting us to perform your surgical procedure. We take your decision very seriously and believe it is a privilege to care for you. We are confident that you will receive the very best, comprehensive, and compassionate care during your stay.